Hello everyone, I am urologist Omer Erdamakaya. Today I will talk about erectile dysfunction that develops due to a psychological or a traumatic event. Because this is a condition we see frequently in young people. It is a temporary condition, but it is not clear how long it lasts. It can last for a week or 5 years. It may vary depending on the psychological event or trauma. Depending on whether the trauma continues or not. I'm going to read a WhatsApp message from a friend who reached me via WhatsApp. Here's what he said. I am 27 years old. I had a sexual intercourse 2 months ago. I had a distant relationship. After that day, my sex drive suddenly disappeared. Friends, the suddenness of this event already gives us a question mark that it may be psychological. He continues, I have been like this for 2 months. I have an erection during sleep, but during the day I have no erection at all. I went to the urologist. He said everything was normal. He gave me 5 milligrams of Tadin. So I have to say that it is the equivalent of Cialis or Lifta. Now we come to the point, he said. After the intercourse, I stressed with HIV anxiety. At first, my tests came out clean, thank God. 2 months passed. Still the same. This situation affects me very badly. My sleep is disturbed. I wonder if it will pass or not. Has anyone else experienced this situation? I constantly think about it. I never had such a problem before. Please give me some information. I am about to go crazy. I don't want to use antidepressants. All I want is to overcome this situation. I will get married in the future. Now, of course, this friend is still worried that he might have HIV because 3 months have not passed. After 90 days, the accuracy of HIV tests increases much more. There is also a sense of regret that he had that intercourse. A serious regret. Why did I make this mistake? How did I make this mistake? Will I pass this on to my fiancé or my wife? Will my marriage fail? Will my plans be ruined? Of course his sleep is disturbed. He wakes up in the middle of the night. He thinks about it. He can't sleep. Now, under such a psychological pressure, of course sexuality falls into the second plan. Erection quality decreases. Why? Because he blames his erection anyway. He blames his erection coming from his body. He thinks it is guilty. He blames himself. He blames the quality of his erection. As I have already read here, this patient did not have intercourse again after the first intercourse. So for this patient to recover psychologically, he needs to prove himself with a sexual relationship. But we also tell patients this. Now, these patients sometimes masturbate themselves and constantly put their erection and penis to the test. They say that it gets softer, stays hard, stays thin, stays like this. We forbid masturbation for a certain period of time. Because the person should not constantly put his penis to the test by himself, so that he does not get stressed. There are some antidepressants. We can use them. There are drugs that do not impair erection and increase sexual desire. But these are not necessary either. Or there are some herbs. I put these under the videos. They can also be good for the patient temporarily. This person needs to get rid of the psychological trauma and HIV anxiety. That will disappear with the test he will have a few months later. Of course, he should not panic about this. He needs to go to a few more doctors, listen to their recommendations and calm down. He can meditate or do sports to calm down. He needs to focus his mind on something else for a few months. Because right now all his concentration is on his penis, on his erectile capacity, and he is also worried about HIV that he might have caught. These situations are definitely temporary. Of course, when a patient comes in like this, you have to do all the tests all over again. In other words, testosterone and other biochemical tests must be done. It is necessary to give the patient detailed information. And it is necessary to calm him down. In particular, it is necessary to make him overcome his concern about HIV. The probability of this friend getting HIV is between 5 to 8 out of 10,000. In other words, we can even say that it is below 1 in 1,000, which is a very low rate. May God heal our friend. I think he will recover after a certain period of time within a few months. Thank you for listening. Best regards.